Today, we will be talking a little bit about atrial fibrillation. Well, atrial fibrillation is the most common arrhythmia that happens in the United States. Multi-million people have it, and it can cause a lot of problems to most patients. So what is atrial fibrillation? Well, atria means the upper chamber of the heart, fibrillation means it fibrillates. So fibrillates meaning it becomes very chaotic and irregular and not rhythmic. So let's go back and understand a little bit about the anatomy of the heart. The heart is a very unique organ that it works by itself, even when disconnected from the brain. That's why sometimes you hear that somebody who's brain dead, but the heart's still beating. When we were budding students in medical school many years ago, we used to dissect frogs, and when we did that, we took the heart of a frog out to do some physiological testing on it, and it would be beating for about an hour and a half outside the frog's body. The reason being, the right upper chamber of the heart, there is few cells that act as a battery. These battery, we call that the sinus node. The sinus node acts as a battery that emanate electrical activity that beat for a certain amount of beats per minute, 50, 60, 70 beats per minute. These impulses that come from the right upper chamber of the heart goes to the middle of the heart, where there is a relay center sitting in the middle of the heart. That relay center function is to distribute these impulses down to the lower chamber of the heart. From there, the impulses go to a specialized nervous system or wiring system that goes to the lower chamber of the heart, and after the impulse goes there, the lower chamber of the heart would contract and the blood would go to the rest of the body, either the brain or the rest of the body. Now, in the left upper chamber of the heart, there are four veins. The function of these veins is to bring oxygenated blood back from the lung to the heart. Now, the problem with these veins are, like all the veins in the body, they should be electrically silent. They should have no electrical activity in them or any triggers. In the patients that develop atrial fibrillation or have the propensity of developing atrial fibrillation, these veins are very electrically active. They have so many cells in them that become hyperactive. And really, that's the main reason of atrial fibrillation. These triggers that are present in the pulmonary veins that makes the heart go in that chaotic rhythms. I tell people, think of atrial fibrillation as if you bought one of these automatic starter for your car, and all of a sudden it just starts working haphazardly by itself and the car keep restarting. That's exactly what happened. You've got these triggers in the veins that keep restarting the heart into fibrillation. There are three problems with atrial fibrillation that you need to be aware of. Number one is symptoms. People can feel the palpitation, the irregularity of the heartbeat. However, people tend to feel more the symptoms of atrial fibrillation, which is fatigue, tired, short of breath, unable to go up the stairs of the subway. You know, I used to walk 3 or 4 blocks, now I'm doing half a block and I'm getting short of breath. So reduction of the exercise tolerance is mainly one of the problems of atrial fibrillation. The reason being, when you go to atrial fibrillation, you lose the atrial component of the pumping capability of the heart, which is about 30%. So I tell people, think about it that way. If there is 1 cup of blood that comes out for every heartbeat in normal patients who have atrial fibrillation, only 70% of the blood comes out of the heart and 30% stagnate or stays up in the upper chamber of the heart. That brings us to the second problem with atrial fibrillation. So one is symptoms, 2 is a stroke. What happens in atrial fibrillation is the upper chamber now is not squeezing, the blood does not go down to the lower chamber of the heart, and what happens is the blood stagnates up in the upper chamber of the heart. Blood clot can develop, and when the blood clot develops, there is a direct access to the brain through the carotid arteries, and people can develop a stroke. Believe it or not, 40% of patients who come to the hospital with stroke find out that they have atrial fibrillation for the first time after they have stroke. Of course, that's not the way that we want to see our patients have, so we want you to be aware of that. The last problem that happens with atrial fibrillation is heart failure. So patients typically, when they have normal heartbeat between 50, 60, 70 beats a minute, they have a total heartbeat per day is about 80,000 to 110,000. So that's your trivia question when you go on a game show. However, when you go to atrial fibrillation and your average heart rate raises up to about 110 or 120 beats per minute, what happens is your total heartbeat raises up to about 250,000. The lower chamber of the heart is not made to sustain these very high heart rates, and people start developing heart failure symptoms, weakness of the heart, shortness of breath, fatigue, and tired. As you can see, 3 problems, we don't like any of them, and that's why atrial fibrillation is a disease that needs to be tackled early with all medications. But the first thing we do typically for atrial fibrillation is anticoagulation to prevent stroke, and we have a lot of scoring system that we use to see who at high risk of developing a stroke. It's called the CHADS-2 score or the CHADS-VASc score. We'll talk about them in a different day. However, the higher the score, the more probability of the patient having annual risk of stroke is high, and anticoagulation should be introduced. Again, we will talk later about warfarin versus the newer drugs that are available and which one is choose and which one is better. Obviously, after we start anticoagulation, we need to get the patient directly to normal rhythm, and cardioversion or electrical shock to the heart to reset the cycles and put the patient in atrial fibrillation is the first step that we always use. It's almost always successful, however, it's almost always fails. So you do cardioversion just to make sure that the patient does not develop the symptoms of heart failure, but also to make sure that the patient is symptomatic in atrial fibrillation, and that's something that a lot of time we do to make sure that the patient understands the difference between their symptoms in atrial fibrillation and symptoms in sinus rhythm. Now, after that, there are 2 ways to treat the patient: either giving the patient medication to try to suppress atrial fibrillation. Most of these medications are called antiarrhythmic drugs. They're strong drugs that they have a lot of side effects, have efficacy of about 20% to 30%. Or we do a catheter procedure where we go from the veins of the legs all the way up to the heart, targeting these cells that I told you about, these triggering cells, and eliminating all of them with a success rate of about 70-75%. About 10-15% of patients require probably a touch-up procedure that brings up the success rate of this ablation procedure to about 85 to 90% in most good centers who will do many of these. Most patients would require to be in anticoagulation for a long period of time, and typically for our patient, we like to monitor the patients 24/7, and we suggest to our patients to have what we call an implantable loop recorder, which we'll discuss in a later video, just to have the monitoring of the patient for 24 hours. I hope that short video gives you a concise description of atrial fibrillation and what can we do about it. And if you have any further question, please email me at drdreaziz@gmail.com. I will answer all your questions in the next video. See you later. Stay healthy, my friend.